Have you ever found yourself, deep in the familiar rhythm of healing patients one person at a time inside the clinic or the hospital, and maybe thought, this is amazing work, incredibly rewarding, but what if I could do more? What if I could somehow amplify my impact, maybe on a much larger scale, beyond just the walls of my practice? It's a question I think that resonates with a lot of dedicated medical professionals, that feeling of wanting to address things more systemically. Well, today we're taking a deep dive into exactly that question. We're exploring a really transformative next step for MBBS doctors in Pakistan pursuing a Master of Science in Public Health, or MSPH. We've been immersing ourselves in this comprehensive guide called MSPH after MBBS in Pakistan, a doctor's guide, and it draws key insights directly from the Health Services Academy. And the material suggests pretty strongly, actually, that this isn't just, another qualification. It's presented as a profound shift in how you can leverage your medical expertise.
Yeah, absolutely. And what we're going to try and unpack today is how this specialized degree, this MSPH, it really extends your clinical skills, your know-how, into a much broader horizon. It's about equipping you to influence the health of entire communities, maybe design large-scale health programs, and potentially even shape national policy. So our mission today really is to illuminate the profound benefits, but also the practicalities of this path, helping you understand how an MSPH could genuinely redefine your medical career and, like you said, magnify your impact in ways you might not have even imagined yet.
Okay, let's unpack that core idea then. This paradigm shift, moving from the clinic to becoming a community health leader. Our deep dive into the source material, it highlights this really fascinating contrast. It talks about healing patients one at a time versus the potential to protect entire communities. What's really at the heart of this shift? And crucially, how is it presented not as leaving clinical medicine behind, but as a powerful extension of it?
That's a great way to put it. What's truly fascinating here is the conceptual leap involved. Clinical medicine, as every doctor listening knows intimately, focuses intensely on the individual.
Right.
It's all about diagnosis, treatment, ongoing care for that one person right there in front of you. It's often, reactive, responding to an illness or an injury that's already happened. Public health, on the other hand, operates at a much, much wider scale. It's fundamentally proactive. It's dedicated to prevention, health promotion, and protecting entire populations. And MSPH bridges this gap. Explicitly. It doesn't ask you to abandon your clinical foundation, not at all. Instead, it equips you to take that deep understanding you have of human health, of disease, and apply it to address the root causes of illness at a community level, or even a population level. So, rather than just managing symptoms once they show up in one person.
You're trying to stop them from appearing in the first place.
Exactly. Think about it. Instead of constantly treating cases of, say, a preventable illness, you're learning how to eliminate the conditions that cause that illness in the first place. And that impacts health outcomes for thousands, potentially millions. It's about seeing the bigger picture of human health and taking action on a monumental systemic scale. And, to go a bit deeper, the problem-solving approaches themselves are fundamentally different. In the clinic, a doctor engages in, mostly reactive problem solving. The patient comes in with symptoms, you diagnose, you treat based on the best medical knowledge you have. In public health, the approach is proactive, it's preventative. You identify population-level health issues. Maybe it's a rise in maternal mortality in one district, or maybe a surge in respiratory illnesses near an industrial area. Then you investigate the underlying factors, the social, economic, environmental drivers behind these trends.
So you're like a health detective for a whole community.
In a way, yes. And your MBBS foundation, that deep understanding of individual patient care, of disease pathology, that becomes a unique and incredibly powerful strength when you apply it to these population-level challenges. You've seen disease up close. You understand the nuances of human physiology, how healthcare systems interact with individual lives. This ground-level insight, this empathy, it means that when you're designing a public health intervention, you're not just doing it from some abstract theoretical place. You're doing it with a practical understanding of how it will impact real people, how it fits into existing clinical realities, cultural contexts. That dual perspective, it's incredibly valuable.
That makes perfect sense. So it's not just about dealing with more patients. It's a different kind of problem solving, looking at the whole system. Can you maybe give us an example, something illustrative that really brings the shift to life? Maybe a scenario where a doctor's individual impact meets this broader public health approach.
Absolutely. Let's imagine, for instance, a doctor treating a single case of typhoid in their clinic. They prescribe antibiotics, they provide supportive care, counsel the patient on hygiene, vital work, life-saving work, focused on that one individual. Now contrast that with a public health doctor. Maybe they identify a cluster of typhoid cases across several villages. So they investigate the local water sources, discover there's widespread contamination. They then mobilize resources to implement a clean water initiative for the entire district, and maybe develop a comprehensive public awareness campaign about safe water practices.
Wow. Okay. So the second doctor used their medical knowledge but added these other tools.
Precisely. They added public health tools. They shifted from just reacting to the problem in one person to proactively eradicating its cause for an entire community, preventing countless future cases. They've preempted suffering at its source. That's a profound shift. And this isn't just about treating more people. It's learning how to truly prevent illness on a large scale. This kind of dual perspective is profoundly needed, especially in countries like Pakistan, which faces, a whole array of complex health challenges. We're talking infectious disease outbreaks, the persistent burden of non-communicable diseases, significant disparities in health access, the impacts of environmental factors. The list goes on. There's a huge societal need for doctors who can not only treat the sick, but also prevent illness on a massive scale by understanding that interplay between clinical realities and the broader public health determinants.
That really does paint a powerful picture of broader influence and deeper impact. So, if that's the big picture of the shift, let's zoom in a bit. What does this really mean for your career path for an individual doctor? Our material makes it very clear, and MSPH opens doors beyond the hospital ward. It actually lists prestigious careers with international organizations, WHO, UNICEF, the World Bank, alongside national and provincial health departments, research institutions, NGOs. It literally promises a transition from a clinician to a health leader, planner, and policymaker. That sounds like a complete redefinition of your professional identity.
It really is. And, this isn't just about different job titles, though those are part of it. It's about a fundamental transformation in your professional identity and, crucially, the scale of your influence. As a clinician, you make critical, life-saving decisions for one patient at a time. Incredibly noble, vital work. But as a public health leader, you could be shaping policy that affects millions of people, influencing the health trajectory of an entire nation, maybe even multiple countries. Your MBBS provides that absolutely critical understanding of disease, of clinical care. But the MSPH adds the analytical tools, the strategic thinking, the management skills to systemically intervene in health issues.
Can you give an example of that? Like, what might that look like in practice?
Sure. So, for example, within an organization like the World Bank, you might be designing health financing strategies for an entire region, working to ensure healthcare is accessible, affordable for vast populations. So you're moving from prescribing medication for one person to designing the systems that deliver care to millions. Or, say, at UNICEF, you could be leading large-scale child immunization campaigns across multiple provinces, directly contributing to eradicating diseases like polio or measles on a truly monumental scale. These are roles where that clinical insight meets strategic planning. You become a leader who understands both the patient's bedside and the policy table. It's a unique combination, and believe me, it's highly sought after. The real revelation isn't just, getting a job title at the WHO. It's realizing how your firsthand bedside understanding of human suffering becomes this unparalleled asset when you're crafting policies. Policies that truly resonate and impact real lives, a perspective that's often missing, frankly, from purely policy-focused roles.
So it's about bringing that clinical empathy to the system level.
Exactly. And to elaborate a bit more on that, the skills needed for leadership, planning, policymaking, and health, they're cultivated quite rigorously in an MSPH program. You learn strategic thinking, how to foresee health challenges, anticipate their impact, plan long-term interventions. You gain expertise in advanced data analysis. That's crucial for spotting patterns, predicting outbreaks, making evidence-based decisions that, actually hold up under scrutiny. Communication, negotiation skills are honed too. You need to articulate complex health issues to incredibly diverse groups: government officials, international donors, community leaders, the general public. Project management skills ensure you can translate ambitious policy goals into actual actionable programs, using resources efficiently, getting measurable results.
And understanding the context is key too, right?
Yeah, absolutely. Understanding the socioeconomic context allows you to navigate the real-world complexities of implementing health initiatives in diverse settings. An MSPH specifically cultivates these skills by integrating subjects like health policy and management, health economics, advanced research methods. It moves you beyond managing individual patients to managing entire health systems, and this makes you uniquely qualified for the global demand. There's a huge need for public health experts, especially those with a strong clinical background, to tackle complex challenges. Think about a pandemic response. How invaluable is a clinician's perspective, understanding not just the epidemiology, but the pressures on healthcare workers, the practicalities of patient care delivery on the ground?
Right, that makes total sense.
Or consider climate change, how clinical knowledge helps craft policies that mitigate health impacts, maybe understanding vector-borne disease patterns, or the vulnerabilities of specific groups to heat stress. A concrete example. A public health leader might drive the development and rollout of national guidelines for universal health coverage, not just delivering services, but ensuring fair distribution, financial sustainability, tracking its population-level impact, or maybe spearheading maternal health programs, setting up community birthing centers, training local health workers, fundamentally transforming access to care for countless mothers in remote areas. That's the scale we're talking about.
That really highlights how an MSPH bridges that gap between individual care and systemic impact. It's fascinating, and the material also emphasizes learning to see the bigger picture, understanding the social, economic, and environmental determinants of health. It says it equips you to design and evaluate health programs, manage outbreaks, improve healthcare systems. This is all about developing that deep population health perspective.
Yes, and this is a critical point. Understanding what truly makes a population healthy, it's far, far more than just having access to doctors or hospitals, although those are, of course, crucial. A population's health is profoundly shaped by a whole host of factors outside the clinic walls. Things like safe drinking water, sanitation, adequate nutrition, education levels in a community, economic stability, environmental conditions, air quality, exposure to toxins.
So things that aren't typically in a medical textbook.
Exactly. And MSPH gives you the conceptual framework and the analytical tools to dissect these determinants, understand how they interact, and then design targeted, effective interventions. For instance, managing a disease outbreak. It isn't just about treating the patients who get sick in isolation. It involves a complex, coordinated effort. Contact tracing, to find those exposed, robust public awareness campaigns to educate the community on prevention, maybe fundamental community-level sanitation improvements to stop the spread at its source. This holistic, multisectoral perspective is absolutely crucial for creating effective and, importantly, sustainable health solutions. Solutions that go beyond just short-term fixes and actually address the root causes of ill health.
Could you maybe dive deeper into some specific examples relevant to Pakistan, those social, economic, environmental factors?
Sure. Let's take literacy rates and maternal mortality. Where women have higher levels of education, they generally have better access to information about maternal health. They're more likely to seek antenatal care, make informed family planning decisions. All of that contributes to significantly lower maternal mortality rates. Like a powerful social determinant directly impacting health outcomes.
Okay, that's clear. What about environmental?
Well, think about the devastating effects of air pollution in major cities like Lahore, Karachi. The profound impact on respiratory health. That's a direct environmental determinant demanding systemic solutions, not just individual inhalers. And economic determinants. Poverty, food insecurity, these directly influence nutritional status, access to healthcare, susceptibility to various diseases. And MSPH teaches you the methodologies to actually evaluate health programs designed to tackle these complex issues. Things like impact assessments. Did the program actually make a difference in the real world? Cost-effectiveness analyses. Are we using limited resources wisely? Advanced epidemiological surveys to track population health metrics over time.
And how does this differ from how a clinician might approach these problems?
It differs significantly. A clinician might advise an individual patient to wear a mask in polluted air or manage their asthma. Perfectly valid clinical advice. But a public health professional, they'd analyze the air quality data for the whole city, identify pollution sources, maybe industrial emissions, maybe vehicular traffic, and then advocate for policy changes. Urban planning regulations, industrial controls, aiming to reduce pollution for the entire community. It's about understanding causality at a population level and intervening strategically to create lasting, widespread change.
Building on that analytical power, our deep dive also highlights that the program offers robust training in biostatistics and research methodology, enabling you to conduct high-quality studies, critically appraise medical literature, and contribute to evidence-based medicine, which it describes, interestingly, as a highly sought-after skill. So this is all about becoming an expert in research and epidemiology.
Absolutely. And knowledge is most valuable when it's understood and applied correctly, right? In public health, that very often means through rigorous research. Epidemiology, you could say, is essentially the detective work of disease. It's about understanding who gets sick, where they get sick, when it happens, and most importantly, why. And this isn't just about counting cases. It's about designing sophisticated studies, cohort studies, to track long-term trends, cross-sectional surveys to assess prevalence right now, maybe case control studies to quickly identify risk factors during an emerging outbreak.
And biostatistics is the tool for making sense of all that data.
Exactly. Biostatistics gives you the powerful mathematical and analytical tools to interpret the vast amounts of data generated from that detective work, to see patterns, evaluate if findings are significant, make robust, data-driven conclusions. For an MBBS doctor, these skills are truly transformative. You move from being primarily a consumer of medical research reading journals to inform your clinical practice to potentially becoming a creator of it. You could design studies, analyze complex population health data, contribute new knowledge that directly informs public health policy and interventions. And even if you don't become a full-time researcher, these skills make you a far more astute, more critical appraiser of the medical literature you read. This ensures that the health programs, the policies you design or implement, are genuinely evidence-based and effective. You're not just following guidelines. You understand the scientific rigor behind them. You might even be able to critically challenge or refine them based on new evidence or the local context.
So it's a different kind of research focus compared to purely clinical research.
Yes, definitely. The emphasis is different. Clinical research often focuses on the efficacy, the safety of specific treatments or interventions on individual patients, or maybe small controlled groups, often in a highly controlled setting like a trial. Public health research, on the other hand, typically deals with much larger, often diverse populations. It frequently uses observational study designs to identify risk factors in the real world, and it evaluates community-level interventions or policy impacts in those complex, real-world settings. This requires a different set of statistical techniques, things like analyzing disease prevalence and incidence across populations, conducting complex outbreak investigations, evaluating the long-term impact of health programs on entire communities.
And critically appraising literature in this context means looking for different things.
It does. It means understanding potential biases inherent in large population studies, selection bias, confounding factors, recognizing the limitations of different epidemiological designs, and discerning statistical significance from practical relevance for public health. That's key. For example, imagine a study claims a new health intervention reduces a specific disease by, say, 5%. A public health doctor, armed with biostatistics, wouldn't just accept that number. They'd immediately ask, okay, is that statistically significant? Fine. But more importantly, is it practically significant for a population facing widespread health issues? What are the cost implications versus other potential interventions? This skill set gives you a profound competitive edge in a global health landscape that's increasingly reliant on robust data, on solid evidence to make informed decisions. When you can not only understand a public health problem, but also design a study to investigate it, analyze the data, and translate those findings into actionable policy, well, you become an indispensable asset.
Okay, so beyond the data and evidence, our material also makes it clear that an MSPH prepares you to take on leadership roles. It covers healthcare management, health economics, policy analysis. It's about leading health teams, managing projects, allocating resources efficiently. This sounds like a comprehensive boost to leadership and management skills, preparing you for, well, taking the helm of significant initiatives.
That's right. Leaders in public health aren't just technical experts in, say, epidemiology or biostats. They also have to be highly skilled managers and strategic thinkers, capable of navigating complex organizations. This means understanding the nitty-gritty of budgets, navigating tricky human resources challenges in large teams or departments, and really comprehending the complex interplay of political, social, economic factors that fundamentally influence health systems. And if we connect this back to the bigger picture, effective resource allocation, that can literally mean the difference between life and death for communities, especially in resource-constrained environments, which is the reality in many parts of Pakistan.
So the MSPH gives you the tools to make those tough calls.
It empowers doctors to navigate these multi-layered complexities, to make informed decisions about where and how to invest limited resources, and ultimately to optimize health outcomes across an entire system, not just within a single clinic or hospital ward. You genuinely move from managing individual patient care to managing the systems that deliver care for an entire population. It's a truly expansive role.
Can you elaborate a bit on those management challenges? Maybe an example from a health department setting.
Sure. Imagine trying to roll out a new national immunization program across all of Pakistan's remote rural areas. That's an immense logistical challenge, right? You need a reliable cold chain for vaccines. You need to train hundreds, maybe thousands of health workers, manage the procurement of millions of doses, effectively engage diverse communities to ensure they actually accept and take up the vaccine. And MSPH equips you with the project management skills to orchestrate something that massive. Or take health economics, which is a core component. It informs those crucial decisions about resource allocation. For instance, should a limited health budget be primarily directed towards building more hospitals for treating existing diseases? Or should there be a greater investment in preventative programs like sanitation or health education? These might have a wider, longer-term impact, even if the results aren't immediately visible.
So it helps you weigh those trade-offs.
Exactly. Health economics provides the tools to analyze the cost-effectiveness of these different approaches to make evidence-based funding decisions. Examples of projects a public health leader might manage. It could range from developing national guidelines for controlling TB to designing and implementing a comprehensive maternal and child health program for a vulnerable population, maybe in a flood-affected region, or even leading the health sector's response during a natural disaster, coordinating diverse teams, managing scarce resources under immense pressure. These roles demand a unique blend of medical insight, administrative skill, and strategic foresight.
And what's really interesting, and perhaps counterintuitive for some, is that even for doctors pursuing clinical specializations like FCPS, our material says an MSPH provides a significant advantage, especially in fields like community medicine, pediatrics, gynecology, internal medicine. It demonstrates a commitment to comprehensive patient care and population health. This suggests a competitive edge for specialization, even for deeply clinical roles. Many doctors might worry about losing their clinical touch, but it sounds like this actually transforms it.
That's a crucial point, and it directly tackles that common concern about losing the clinical touch. It raises that important question. How does a macro-level public health degree actually enhance micro-level clinical specialization? It might seem counterintuitive at first, but it's incredibly synergistic. Many doctors do worry about stepping away from direct patient care, and that's understandable. But what we've discovered, and what the evidence suggests, is that an MSPH doesn't dilute your clinical skills, it transforms them. It can make you a more empathetic, more effective clinician precisely because you understand the entire ecosystem your patient lives in.
So it adds context to the clinical picture.
Exactly. Consider a pediatrician. Their main focus is the health of individual children. But with an MSPH, that pediatrician's understanding expands dramatically. They wouldn't just treat individual cases of childhood malnutrition. They'd also be equipped to identify the community-level factors contributing to it. Maybe widespread food insecurity in the area, maybe a lack of access to clean water in local schools, perhaps insufficient immunization coverage in a specific neighborhood. They could then advocate for, or even help design, broader public health interventions addressing those root causes, which would hopefully lead to fewer sick children coming into their clinic in the first place. It expands their understanding of the patient's context, leading to more holistic and ultimately more effective care plans. It truly makes them an invaluable asset in their chosen specialty. It shows a commitment to comprehensive patient care that extends beyond the hospital walls because they understand the whole ecosystem around the patient.
Could you maybe flesh that out for the other specializations mentioned? Gynecology, internal medicine.
Sure. For a gynecologist, understanding reproductive health policies, community-level access to maternal care, the factors influencing family planning decisions, that can profoundly transform their practice. They might not just treat individual obstetric complications. They could also work to improve antenatal care uptake in underserved communities, maybe advocate for policies that enhance women's access to healthcare infrastructure, or lead programs that reduce maternal mortality at a population level by tackling endemic barriers. In internal medicine, recognizing the huge impact of environmental factors, like air pollution, on chronic respiratory diseases, or the socioeconomic determinants driving the high prevalence of diabetes and hypertension. That allows the physician to offer more holistic advice, maybe get involved in prevention programs. They move beyond just treating the disease in the individual to understanding its origins and spread in the community.
And for community medicine, it's almost a natural fit.
Absolutely. Community medicine is already inherently population-focused, and MSPH provides an advanced theoretical framework, practical tools for epidemiological investigation, health program management, health promotion. It deepens their existing expertise and enables them to lead at a much higher level. So the MSPH doesn't just add a layer of knowledge, it enriches and broadens the clinical perspective. It creates specialists who are acutely aware of the larger forces shaping their patient's health and are capable of intervening effectively at multiple levels: individual, community, and policy.
Okay, so with all these profound benefits, this expanded scope of impact, the question then becomes, where should you pursue this transformative degree? Our source material strongly highlights the Health Services Academy, HSA, calling it Pakistan's first premier institute in public health, recognized as a leader in the field. What does that premier status really signify for someone thinking about applying?
Yeah, that premier status, that leadership position, it isn't just a title. It signifies a really robust legacy of pioneering public health education and research in Pakistan. Being the first premier institute means HSA has spent decades right at the forefront, literally shaping the definition of public health education and practice in the country. This suggests a real depth of experience, a curriculum that's been refined over many years, and importantly, a vast network of influential alumni. Many are now leaders in public health across Pakistan and even in major global organizations.
So that network could be quite valuable.
Invaluable. And this institutional credibility means HSA is often directly involved in, or at least highly influential in, tackling national health challenges. They might be advising on policy, implementing ground-level interventions. This deep connection to real-world impact ensures the education they provide is highly relevant, practical, and up-to-date with the country's most pressing health needs. Their faculty members are often practitioners themselves, policymakers, leading researchers, bringing invaluable contemporary experience and networks right into the classroom.
That makes a lot of sense, connecting the education directly to national impact. And one of the most practical benefits HSA seems to offer, especially for working doctors, is its flexible schedule. Our material states HSA uniquely understands the demands of a medical career, offering flexible timings including morning, evening, and weekend classes. This allows you to pursue your degree without putting your clinical practice on hold. That's huge for many people.
It is huge. And what's truly ingenious here is HSA's practical, almost empathetic understanding of its target audience. For a working MBBS doctor taking 2 full years off clinical practice for a master's, that can represent an immense financial burden. Loss of income, a pause in career progression, maybe even a fear of dulling those valuable clinical skills. By offering these genuinely flexible schedules, morning, evening, and weekend classes, HSA removes a major barrier. It makes advanced public health education not just accessible, but actually sustainable for dedicated medical professionals.
So it's designed with their reality in mind.
Exactly. This consideration for work life, or rather study-work integration, it speaks volumes about their commitment to developing public health leaders from within the existing medical workforce, rather than forcing them to step out entirely. And this approach, it doesn't just support individual doctors in advancing their careers without undue hardship. It also contributes significantly to building a stronger, more experienced public health sector for the country overall. Because professionals can often immediately apply their new learnings in their current roles. It creates this virtuous cycle of learning and application.
Can you elaborate a bit more on the real-world implications of that flexibility?
Sure, for doctors, it allows them to maintain their income, continue supporting their families, a critical factor for many pursuing postgraduate study. It also ensures they can keep their clinical skills sharp and current, which is important for their professional identity, patient care, and future career options, even if they move more into public health. Plus, it allows for that immediate application of new public health knowledge to their ongoing clinical practice or maybe existing administrative roles. Makes the learning feel deeply relevant and immediately impactful. In the long run, this model builds a stronger public health workforce because it enables those mid-career professionals who bring invaluable clinical experience to upskill and transition into leadership roles without the severe disruption a full-time and flexible program would demand. It's a strategic investment in human capital that benefits both the doctor and the national health system.
And the value of this degree seems really cemented by its prestigious recognition and value. Our material highlights the HSA MSPH program is fully approved by the Higher Education Commission, HEC, and the Pakistan Medical and Dental Council, PMDC. This ensures the degree is valued nationally and internationally. Why is this dual approval so absolutely critical for a doctor in Pakistan?
Oh, it's absolutely critical. For an MBBS doctor in Pakistan, the importance of this dual approval really cannot be overstated. The HEC, the Higher Education Commission, is the primary regulatory body for all higher education in Pakistan. Its approval signifies the MSPH program meets national academic standards, robust curriculum, qualified faculty, adequate resources. It ensures the degree holds academic weight, recognized for scholarly rigor across the country. The PMDC, the Pakistan Medical and Dental Council, on the other hand, regulates medical education and practice specifically. Its approval means that from a medical professional standpoint, the MSPH is recognized as a valid, valuable postgraduate qualification for doctors. It confirms it meets the professional standards expected of medical practitioners.
So it covers both the academic and the professional angles.
Precisely. And this dual accreditation is particularly important for government jobs and international opportunities. Many official positions, especially in the Ministry of Health or other public health agencies, explicitly require degrees from HEC-approved institutions. And for medical professionals, PMDC recognition adds that undeniable layer of professional legitimacy. This comprehensive, formal recognition provides a robust, unquestionable foundation for both domestic and international career progression. It opens doors that a degree with less comprehensive accreditation simply might not. It gives graduates security and clarity, especially those aiming for positions of influence in the public health sector.
Okay, beyond the recognition, the program's foundation obviously lies in its comprehensive curriculum. Our deep dive reveals it covers all the core areas: epidemiology and biostatistics, health policy and management, environmental and occupational health, social and behavioral sciences and health, and research methodology and thesis. How do these diverse areas kind of synergize? How do they work together to create a truly well-rounded public health professional?
That's an excellent question, and understanding this synergy is really key to appreciating the program's depth. This curriculum is meticulously designed. It aims to create a truly well-rounded public health professional who has a holistic understanding of health challenges and, crucially, the diverse tools needed to address them. So epidemiology and biostatistics, for instance, provide the scientific backbone, those analytical skills to understand disease patterns, causes, trends. Then health policy and management teaches you how to translate that scientific understanding into actual, actionable policies, how to influence decision makers, how to effectively administer and lead complex health systems.
So moving from data to action.
Yes, exactly. Then environmental and occupational health addresses those external factors that profoundly affect well-being, pollution, unsafe housing, workplace hazards, and teaches you how to design interventions to mitigate those risks. Social and behavioral sciences delves into the critical role of human behavior, cultural norms, community dynamics, and health outcomes. This helps you design interventions that are actually accepted and adopted by the populations you're trying to reach. And finally, that research methodology and thesis component. It provides invaluable hands-on experience in generating new, original evidence, cementing your ability to contribute to the scientific body of knowledge yourself. It's a holistic approach. It ensures graduates can tackle the multifaceted, complex health challenges of today's world with a comprehensive toolkit that no single discipline alone could offer.
Could you give a quick practical application for each of those core areas, just to illustrate?
Sure. Take social sciences. How do they help design effective health campaigns? By understanding local cultural beliefs, communication styles, community structures, you can craft health messages that genuinely resonate. They're far more likely to lead to desired behavioral changes like better hygiene, increased vaccination rates, healthier diets. Okay, environmental health. You're not just aware of poor water quality. You're equipped to analyze water safety reports, identify specific contamination sources, industrial, domestic, and then implement effective interventions, maybe community water purification programs, or advocating for stronger environmental regulations. Each of these components builds on the others. It ensures an HSA graduate isn't just scientifically literate, but also socially aware, policy-savvy, and practically capable of managing and leading health initiatives in diverse, challenging settings.
Right, that makes the synergy very clear. Now let's talk about navigating the journey itself, the logistics. Our material states the program is typically completed over 2 years, structured into 4 semesters. How does this time frame compare, and what should prospective students think about this commitment?
Yeah, a 2-year commitment for a master's degree is very standard, actually. It's a globally recognized time frame for comprehensive postgraduate studies like this. What makes it particularly manageable here, as we've discussed, is HSA's flexible schedule for working professionals. It is a significant investment of time and intellectual effort, no doubt about it. But it's one that, as our sources strongly indicate, yields substantial returns. In terms of career growth, professional influence, and just the sheer scale of impact you can achieve. It's a structured path designed to ensure thorough learning within a practical duration, allows for deep engagement with the material without dragging out the educational journey unnecessarily. It's typical for master's programs aiming for both theoretical depth and practical application.
And regarding the financial aspect, the investment, our material mentions the total fee is approximately PKR $300,000 to $400,000, payable per semester. is described as highly competitive for a degree of this stature, and it notes that financial aid and scholarship options may be available for deserving candidates. What's your perspective on this cost, given the potential return?
Well, when you talk about an investment in your future, that fee range, PKR 300K to 400K for a master's degree from a premier, highly recognized institution like HSA with that dual accreditation, it really is highly competitive, especially in the Pakistani context and even internationally compared to similar quality programs. When you compare that cost to the potential career advancement, the significant increase in earning potential down the line, and maybe more importantly, the unparalleled scale of impact an MSPH graduate can achieve, moving from individual care to influencing population health, it represents excellent value. It's crucial, I think, for prospective students to view this not just as an expense, but as a strategic investment in their future leadership capacity within the health sector. And the specific mention of financial aid and scholarship options, that really underscores HSA's commitment to accessibility, making this advanced education available to deserving candidates, which speaks to their mission of building a robust public health workforce across Pakistan, not just for those who happen to have the immediate financial means.
For those wanting to dig even deeper into the academic side before applying, our material states the curriculum provides a thorough grounding in public health principles, with a detailed semester-wise breakdown available right on the HSA website's academic program section. What does this transparency offer aspiring students?
Oh, that transparency is incredibly valuable. It allows aspiring students to thoroughly research and really understand the academic journey ahead of them, semester by semester, before they even apply. Seeing a detailed semester-wise breakdown demonstrates a well-structured, thoughtfully designed program. You can see the logical progression of learning from foundational principles to more advanced applications and specialized areas. It allows you to plan your studies mentally, anticipate the workload, clearly see how each course contributes to your overall development as a public health professional. This level of detail empowers potential applicants to make a very informed decision about their educational investment. They know exactly what to expect.
Okay, our material also includes a very helpful frequently asked questions section addressing some key practical concerns. Let's run through those quickly. First up, I'm a full-time doctor. Can I really manage this program? And the guide's answer is quite explicit. Absolutely. HSA specifically designed its morning, week, and weekend schedule to accommodate working healthcare professionals like you.
Yeah, and this directly addresses what is arguably the #1 concern for many MBBS doctors thinking about postgraduate study. It's not just a marketing claim. It seems to be a foundational design principle of the program. It shows HSA genuinely understands the demanding realities of a medical career. This targeted flexibility acknowledges the immense commitment required of doctors and actively works to integrate advanced education into their existing professional lives, rather than forcing that impossible choice between career and further study. It makes advanced public health education achievable for dedicated clinicians who want to expand their impact without completely disrupting their current practice. It's a critical differentiator for HSA, I think, and really speaks to their focus on building that workforce from within the existing medical community.
Next, a very important question for anyone aspiring to public service. Is an MSPH from HSA recognized for government jobs? The answer here is a resounding yes, completely. The dual approval from HEC and PMDC makes it highly recognized for all government posts requiring a public health specialization, including those in the Ministry of Health.
This is such a key insight for anyone aiming for career progression within the public sector. That explicit recognition by both HEC for academic standing and PMDC for medical professional validity, it just eliminates any ambiguity. It unequivocally confirms the degree's legitimacy and validity for those crucial government roles. It offers a clear, secure path for those aspiring to leadership positions within national and provincial health departments, including the Ministry of Health itself. This official endorsement provides graduates with significant credibility and opens up a wide array of public service opportunities, ensuring that your investment in an MSPH is formally acknowledged and valued by key employers in the sector.
Now, for those maybe with global ambitions, a question asks, how does this degree help if I want to work abroad? The response highlights that the core competencies are globally relevant, providing a strong foundation for working with international health bodies and serving as a stepping stone for global career opportunities.
Right, and the critical point here is what makes these competencies globally relevant. The reality is major public health challenges, think about global pandemics like we've seen, persistent issues like maternal and child health, the rise of non-communicable diseases everywhere, the health impacts of climate change. These things don't respect national borders. The analytical skills, the epidemiological methods, the policy-making approaches you acquire at HSA, they are universally applicable to these complex, cross-cutting global issues. Whether you're analyzing disease patterns in Pakistan, or designing a health system strengthening program in another region, or participating in an international disease surveillance effort, the fundamental principles and methodologies are the same. This degree provides a solid, recognized credential for anyone aspiring to work with international NGOs, think Médecins Sans Frontières or UN agencies like WHO or UNICEF, or participate in global health initiatives worldwide. It positions graduates as competitive candidates on the international stage, bringing that valuable global perspective on health.
Another clarifying question that often comes up. What is the difference between an MPH and an MSPH? Many people wonder about this. Our material explains that both are valuable, but an MSPH often has a stronger emphasis on scientific research methods and a thesis component, making it ideal for doctors interested in evidence-based practice and research. It notes an MPH can be slightly more generalist.
Yeah, this distinction is actually quite crucial, especially for an MBBS doctor. Given their rigorous scientific training background, the research-heavy nature and that mandatory thesis component of the MSPH would likely resonate more deeply. It aligns perfectly with the desire to contribute directly to the scientific evidence base in public health. It suggests a pathway for doctors who want to delve deeply into the science of population health, who want to critically evaluate complex data, and potentially shape national or even international health guidelines through their own original research. It really emphasizes the rigorous quantitative and qualitative research skills needed to generate new knowledge.
So the MPH is maybe broader, the MSPH more research-focused.
Generally speaking, yes. While an MPH offers a broader, perhaps more generalist overview of public health practice, very valuable in its own right, the MSPH offers that specialized scientific depth. That can be particularly appealing to someone with a strong clinical background and a real desire for evidence-based impact and for contributing to the scientific discourse. It truly gears you towards potentially becoming a scientific leader in the field, capable of not just implementing evidence but also generating it.
Okay, and finally, for those ready to take the leap, how do I apply?
Yeah.
The material states the process typically involves submitting your academic documents, MBBS degree, PMDC registration, a statement of purpose, and letters of recommendation. And it advises keeping an eye on the admissions portal on the HSA website for deadlines and specific forms.
Right. While the process sounds straightforward submitting documents, it definitely requires careful preparation. That statement of purpose. It's your critical opportunity. It's where you articulate your vision for public health, explain why you're pursuing an MSPH, and how it aligns with your long-term career goals. This is where you connect your clinical experience to your aspirations for broader impact. Show how your time at the bedside has genuinely inspired a desire to impact entire communities. And those letters of recommendation, good ones from clinical supervisors or mentors, can significantly strengthen your application. They showcase your dedication, your work ethic, your potential for leadership in the public health sphere. Paying close attention to deadlines, making sure all documents are meticulously prepared, that's absolutely key to a successful application. This is really your chance to demonstrate your passion and your suitability for this transformative path.
So we've taken a really deep dive today into how an MSPH after your MBBS isn't just about, adding some letters after your name. It's about a profound transformation of your professional identity, your scope, your potential impact, from broadening your career pathways dramatically to becoming a leader in population health, gaining those invaluable research, epidemiology, and management skills. This degree truly offers a pathway to amplify your impact on a monumental scale. And HSA, with its flexible schedule tailored for working professionals, its prestigious national and international recognition, and that comprehensive synergistic curriculum, it really presents a compelling platform for making this transformative journey.
Yeah, I think what we've discussed today powerfully reinforces the idea that medicine is constantly evolving, constantly expanding its horizons. The ability to heal individuals one person at a time remains absolutely paramount, deeply noble work, no question. However, the urgent need to address health at a systemic level, a community level, even a global level, that's equally vital in our interconnected world today. We face complex challenges, from emerging infectious diseases to the pervasive burden of non-communicable illnesses. An MSPH empowers an MBBS doctor to navigate both these realms, to lead with both that profound clinical insight and strategic public health wisdom. It's about making a strategic investment in your future as a health leader, equipping yourself to face the complex, dynamic health challenges of our world with an expanded toolkit and a truly magnified vision.
So what does this all mean for you, the listener?
Well, perhaps a critical question for you to consider is this. In a world facing ever-increasing health disparities, emerging infectious diseases, global challenges like climate change, how will you choose to leverage your invaluable medical expertise? How will you contribute to health on a monumental scale, not just within the familiar walls of the clinic, but across entire communities, potentially shaping the future of health for generations to come?